Hi, Moldies. Happy whatever day of the week this is. I'm doing a couple recordings as I delight in the natural vitamin D of Florida. And my first post, I really wanted to talk about seasonal affective disorder because I know that this affects a ton of people, right? Seasonal affective disorder basically is like a mild or sometimes moderate or severe form of depression that is especially experienced during these times of the year where we don't get enough natural sunshine, right? Where it gets, it's dark when we leave for work, it's dark when we come home from work. And for those of you who don't have the option of getting outside and getting natural sunlight, it becomes very oppressive, right? So there are a couple different ways that I deal with seasonal depression in my patients and in myself. I think it's very common. I think most people probably have it if they live in areas like we do. Wisconsin, Illinois, Minnesota, anywhere that doesn't get enough sunshine during the winter months. So first thing I try to do is I try and get some sort of light early in the day, whether it be, if it's a cloudy day, whether it be manufactured light, if you sit in front of like a sun lamp or you do a red light. Doing that early in the day tells your body that it's time to get up, it's time to feel energized, it's time to get on the ball. So that's an easy one. Even if it's cloudy out, if you go for a short walk before you leave for work, that's gonna get all of your hormones online. It's gonna get everything moving so that your brain functions, so that you're doing well, all of that good stuff. So that's number one. Number two, getting enough vitamin D. Studies have shown that just getting your vitamin D up to levels where it should be is enough to reduce seasonal affective disorder almost 80% in most people. So during the winter months, well, actually during all of the months, I take 10,000 IU of vitamin D, but I make sure to balance it with K because K makes sure that we don't have calcifications and that it's properly absorbed. For every 5,000 of D, you want 100 of K. So my favorite product is Metagenics, because it comes in a tiny little gel cap, because who wants to take another big pill? Comes in a tiny little gel cap, and it has 10,000 IUs of vitamin D and 200 of K. So I make sure to take that at night. It is fat soluble, so I take it with my evening meal. Now, some conventional doctors would say that's way too high of a dose. Obviously, we like to check it because it is a vitamin, a fat soluble vitamin. But that being said, I haven't had somebody who gets hypertherapeutic and has any side effects. Plus, this is an immune booster. So if your vitamin D is where it should be and your zinc levels are where they should be, you're not going to get every illness that walks in the door from your kiddos or your hubby or your friends or your family members, right? So that's super important. I obviously do zinc for immune system, also for thyroid health. Zinc is fabulous. So I usually recommend between 30 and 50 of zinc picolinate. I usually ask that people take that with food. It is a metal. So that's one. I have an iron stomach. If I take that on a fast day, I am going to get nauseous. It is not going to do good things for me. So I recommend that with your evening meal. Also a B vitamin. As you guys know, B12 is thermogenic. It helps us to burn. It also is our joyous B vitamin. And B vitamins are water soluble. So the majority of them you can't really overdo, with the exception of B6. Unfortunately, B6 is kind of like the Goldilocks of the B vitamins. It really likes to be in a range. If your B6 is too low, it's going to lead to neuropathy. And if it's too high, it's going to lead to neuropathy. Neuropathy is that weird tingle you get in your legs. A lot of people associate it with restless leg. Diabetics get neuropathy as high sugars destroy their nerves. But it's also associated with low B6 levels as well as high B6 levels. So I usually recommend a methylated B complex so you get all of the B vitamins. If you only take one, you're going to end up with a deficiency of the others, and that's not good for you. So I like a complex. I use pure encapsulations a lot. I use orthomolecular because obviously they're near and dear to my heart, being made in Wisconsin. These are things that are going to help with seasonal affective disorder. Now, I know obviously finances are tight. I know it's difficult to get away, but if you can get away to somewhere with sunshine, and even if you just take a mini break, you take a couple day holiday and you go and you stay somewhere with sunshine, getting out, putting your feet in the sand, putting your feet in the ocean, that's the best cure for seasonal affective disorder. Now, I know it's not economical, right? It's not cheap to fly to Florida. It's not cheap to rent an Airbnb. And also for my moldies, unfortunately, Florida is one of the moldiest states. But it's something that I find if I don't do it during the winter months, I can't keep up with my schedule. It is something that resets, and it doesn't have to be really pricey. Southwest has tons of deals. Right now, the cruises are doing last minute cruise deals for $99 for a 5-day cruise. So there are options to get away on a budget. If you have to, you can drive to Florida and jump on that 5-day cruise. Even if you don't even leave the cruise ship, even if you just sit by the pool and get natural vitamin D, that will help you reset and just rejuvenate and be ready for the rest of winter. I hope this helps, moldies. I hope you're having a magical day, whether you're dealing with blizzard conditions or you're out in the sunshine relaxing. I hope today and every day is magical for you. If this resonates with you, please don't hesitate to share it. Sending you so much love and joy. Love you.